Welcome to PodcastRx, a production of Diamond Pharmacy Services. This is a show about pharmacy, but don't let the title fool you. While we definitely talk with pharmacists about medication topics, we also sit down with nurses, technicians, and other pros to discuss relevant issues in corrections health, long-term care, and so much more. Whether you're a pharmacist, a practitioner, or just find these things fascinating, this is a show for you. On this episode,
so we're really talking about which vaccine is going to be the first.
Deborah Milito returns to the show to talk with us about the progress of a COVID-19 vaccine. As a member of the American Society of Consultant Pharmacists Operation Warp Speed Committee, Deb has an up-close look at the latest news regarding the development and distribution of the COVID vaccine.
Operation Warp Speed is a military operation, so you can well imagine that it moves very quickly.
We chat about these topics, plus the effects of the pandemic on consulting, the role of pharmacists in vaccinating patients, and what Diamond is doing to prepare for the eventual arrival of the vaccine. I'm Adam Campbell. This is PodcastRx. I want to welcome back to PodcastRx Deborah Milito. She is the Director of Clinical Consultant Services for the Long-Term Care Division here at Diamond and the Chief Antibiotic Stewardship Officer. Deborah, welcome back.
Thank you, Adam.
It's good to have you. You last joined us on this show back in January, I believe. We were talking about the transitions of care, medication safety. It's safe to say it was a different world then. So given everything that's happened, especially in long-term care with the pandemic, I just have to ask, how have you been? How have the last 6 to 7 months been for you as a pharmacist in skilled and senior care?
On any given day, I think I would answer it a little bit differently, but we are weathering the pandemic. There is a lot of information that comes out to us almost on a daily basis. So it's being available to read that information, attend a webinar, just review anything that's sent our way so that we can be in a good position to answer questions from the directors of nursing, the nursing home administrators at our facilities, and so on.
Yeah, the amount of info to follow, just as a layperson here, just following the news on it, it's so much. But I can only imagine how challenging that is in a situation like yours.
And I think, Adam, that depending on what channel you listen to, or what newspaper you read, you will be getting different information, and it's just so vital that we get current and correct information from the scientists.
Absolutely. Couldn't agree more with that. When I was talking to you ahead of time before we recorded, you said that you found a rhythm with your consulting work. What exactly does that mean? How have you found the rhythm consulting from a remote perspective?
Sure. So, typically we would be going into all of our nursing homes every 30 days to do a medication regimen review. But I call it the Ides of March, because I think that's about the time when everything came to a halt with the pandemic.
That's
so
right.
we as senior care pharmacists had to readjust what and how we consult, and we began to remotely consult every 30 days. And so the schedule, as far as when you would do it, didn't really change, because we try to keep it at a 30-day requirement. So that didn't change. But what did change is what we had access to as far as information. So most of us continue to have access to a medication administration record, or a MAR, and we can certainly be looking at that in real time to see if there are any refusal of meds, or if the directions aren't correct, or if there are duplicate orders, or if a certain medication needs to be monitored via, for instance, a lab. And some of us are lucky enough to be able to access labs via the electronic health record. Not all, unfortunately, but I'm thinking that with all of this going on, more and more facilities will realize the importance of having the labs available. So that's what we've done with the consulting. As far as our monthly meetings that we attend, like an infection prevention and control meeting or a behavioral health meeting or a falls meeting, we're doing those remotely via a Zoom or Teams or GoToWebinar type of platform.
Mhm.
As far as the quarterly quality assurance performance improvement or QAPI meetings, we are attending those the same way. And then as far as educational in-services, I've done several of those via a Zoom call, which worked perfectly fine. Everyone at the facility would gather in one room. Some people still were in their offices, of course. And I was able to provide the education I typically would have traveled to do. So we're making it work.
That's excellent. I'm curious, what about the pre-Ides of March world do you miss the most when it comes to the consulting?
Well, that's a pretty easy question to answer. I really miss the interaction with, you know, from the customer service people as you walk into a building, the receptionist, the nursing home administrator, the directors of nursing, assistant directors of nursing, the residents that would, you always knew you had a little visitor when you were sitting there consulting, but I'm afraid those days have come to an end for a while.
Yeah, I would definitely have to agree with that based on everything I understand of the situation. Now, switching gears a little bit, Deb, in all the consulting efforts and just general pharmacy work going forward, we can't not talk about the development of a COVID vaccine. It's all over the news. You can't talk about the vaccine itself without mentioning Operation Warp Speed. And of course, for anyone not familiar with that, that's the partnership between the Defense Department, Health and Human Services, which includes the Centers for Disease Control, Food and Drug Administration, National Institutes of Health, and the Biomedical Advanced Research and Development Authority. You're involved with the American Society of Consultant Pharmacists, and you had mentioned that they are involved with this Operation Warp Speed pretty directly. And so I wanted to ask you about that. How did that come to be? We know that ASCP is an advocate for long-term care pharmacies and pharmacists, so it makes all the sense in the world that they're involved with this Operation Warp Speed. But can you tell us how ASCP got involved with that and how you're involved directly with that?
Yes, Adam, I'd be happy to. So Operation Warp Speed is a military operation. So you can well imagine that it moves very quickly. And I'm lucky enough to be on the committee of Operation Warp Speed, in that we have calls every Thursday afternoon to give us a debrief on what has occurred from the various organizations that you previously mentioned. ASCP was very instrumental in requesting that we have a seat at the Operation Warp Speed table. And so we had to submit 10 names of members of ASCP, and then the people with Operation Warp Speed made the decision, and they chose one of our members to be able to be at those meetings. So we feel very fortunate that that person has been seated and that he is able to give us information, like firsthand information, which is, as I said earlier, so vitally important that we have current information.
Yeah, for sure. What are you typically going over in these calls that you mentioned, the Thursday calls?
So we're really talking about which vaccine is going to be the first. And to give you a little bit of history about what's been going on, it looks like the Pfizer vaccine, which will require ultra cold storage, and that's minus 70 degrees centigrade or minus 94 degrees Fahrenheit, probably will be sent to large acute care hospitals that have the capacity for that type of storage. Most pharmacies do not have that capability. And the people that would be receiving that vaccine they're considered in phase 1A, and those would be the healthcare workers. and healthcare workers at hospitals or long-term care facilities or assisted living facilities, and really getting to the granular level of those people that go into every room almost every day, like janitorial services, certified nurse assistants. I mean, they're really wanting everybody to, get the vaccine to prevent the spread of the disease. That's phase 1A. And that might happen towards the end of the year, like late November, December, although that's changing, quote unquote, at warp speed.
Sure.
The second phase is phase 1B, and that is where the residents of a long-term care facility and or assisted living would receive their vaccine. And that would be more in line with Moderna is another one that's testing the vaccines. And it sounds like maybe one might be available, although that's again changeable almost on a daily basis. And I might add that most of these vaccines for COVID-19 are a two-step process. So you receive the vaccine on day 1 and then the second one in 21 days or 28 days. Phase 2 probably won't happen until the summer, and that's pretty much the rest of the community.
Again, you said to me that your head is spinning with all this info. I can't imagine the staying connected with all these developments. I mean, everything is moving, as you said, at warp speed. How do you keep track of it all?
So, on any given week, we have a COVID-19 task force meeting with Diamond. It's every other week. Mm-hmm. And then on Thursday, we have the Operation Warp Speed information given to us. Then on Friday, we usually have an FASCP webinar that's related to COVID in some way. And then usually on Friday, late afternoon into the evening, we get an email from Chad Wars, who's the executive director of FASCP, giving us any more information if another meeting had taken place. Because sometimes there are other meetings after we get the Operation Warp Speed debrief. So he's always sending us those emails, and we even get them on the weekend. And we get calls on the weekend to get a couple people together to, fill in the blank, whatever needs to be done. So it's really on a daily basis that, some organization is sending information about the vaccine, or something from the State Department of Health is sending information. So I have to read it all just to make sure that I'm getting it correctly. And, I always want to give the information correctly and current. So that's very important to me.
Thanks for listening to PodcastRx from Diamond Pharmacy Services. If you're a fan of the show and have any topics you'd like to hear us discuss, or if you have any thoughts on a particular episode you'd like to share, please email us at podcastrx@diamondpharmacy.com. And while you're at it, please rate and review our show wherever you get your podcasts. Your feedback helps us make the best show possible for you. And as always, we appreciate your feedback and support. Now back to the show.
I was curious, Deb, from your perspective, what are some of the bigger questions you have as this whole vaccine process unfolds? Whether it's distribution, administration, what questions linger the most through all of this?
So one of my big concerns is making sure that the vaccine is safe and effective. And, that's going to be up to the scientists that I referenced earlier, that the FDA is not going to release a vaccine until they have direction from ACIP, which is the committee that approves any type of vaccines. And after they approve it, then it has to be published in the MMWR, the Morbidity and Mortality Weekly Report. So that still has to take place. But my concern would be that, all the proper channels are utilized, and they let us know what they feel is safe and effective. So that first vaccine that I talked about, the Pfizer vaccine with the ultra cold storage,
Right.
That's not looking like it's efficacious for seniors. So that's why if anyone's wondering why the long-term care residents aren't getting it first, because the first vaccine may not be efficacious for them. So we have to wait to maybe the second or third vaccine that, they have more people enrolled in those age groups, which, of course is, an obvious that we need the older people in the phase 3 trials to make sure that it's safe and effective. So efficacy and safety are very important to me. And then the distribution could be tricky, but we're working on that daily to see what that's going to look like. And then we, as healthcare professionals, with the physicians, the nurses, the pharmacists, we have to feel confident that we can talk to our seniors and to other pharmacists about how important it will be to receive the COVID-19 vaccine.
Absolutely. Do you foresee pushback with that?
Yes, we do think that there will be hesitancy to receive the vaccine only because it's been so politicized. This is no different than a flu vaccine or a pneumovax vaccine. You want to get it so that you don't contract the disease itself. So we get the influenza vaccine so we don't get the flu. We get the pneumovax so we don't get pneumonia. We get the Shingrix so we don't get shingles. So this is the same concept. It hasn't changed. And we've been dealing in vaccines for many, many, many years.
Right. I wanted to get your thoughts on some news from last month, from September. Health and Human Services announced that pharmacists are authorized now to administer the eventual COVID vaccine in ages 3 and up, I believe. And so that seems like a really big win generally for the practice going forward. I know that pharmacists have been immunizing for what you just mentioned, flu, pneuma, for some time, but just how big of a win is this COVID vaccination designation?
Well, a couple of things with this. I don't know if it was an executive order from President Trump, but pharmacists at like retail settings, they can now give vaccines to kids 3 and up, to people 3 and up. So it was not ever that young. So that was a good thing. And then to be able to give the vaccine seems to be, common sense.
Right.
That we should be able to do that since we're giving the other vaccine. So we're very happy with that, but we thought that it should happen anyway.
Another big news item that I wanted to get your reaction to, relative at least to today's recording. Who knows what will happen in the weeks and days following the recording of this podcast, but Operation Warp Speed will be partnering with CVS and Walgreens to administer the COVID-19 vaccine when it's developed, free of charge to residents and staff of long-term care facilities. This is an opt-in program for the facilities. It's not something that's just being imposed. On the surface, this looks like a win, not only for the health of the residents and staff of these facilities. I mean, it's a free vaccine, but if you're a pharmacist working for an independent pharmacy like Diamond, and we have thousands of residents in our care, and you see these 2 large corporations getting the sort of preferential treatment, I imagine you're going to have some concerns. So how did you greet this news when it was announced, and what are your thoughts on this plan?
Well, this is where ASCP and specifically Chad Wars gets all the credit, because they kept insisting that there had to be a third option. It couldn't just be Walgreens and CVS. It had to be your own pharmacy provider. And I'm happy to say at the end of business on Friday, that was inserted. So each facility got a memo from CDC on Monday, October 19th, that said, getting ready for the COVID-19 vaccine, you have a few choices. You can have Walgreens, you can have CVS, you can have your current pharmacy provider, or you can not make any decision. And you have 2 weeks to decide this, and you can change your mind at any time. So we, as senior care pharmacists, specifically working at Diamond, we're very happy that the facilities can request Diamond pharmacy services, and that you don't have to choose just CVS or Walgreens, because quite frankly, with the climate of what's going on in the facilities these days, in that we as the senior care consultant pharmacists can't even get into our buildings yet. Why would you let a pharmacist come in from a pharmacy that you don't deal with,
Right.
and considered kind of a stranger, coming in? Because
Mhm.
a lot of these facilities aren't even permitting visitors at this point. So I think it's great, that CDC finally saw the light and decided to add that, but it was at much urging from ASCP to include that. So people, the facilities have a choice, and we'll have to see how that goes. There's a lot involved into this vaccine, more than other vaccines. However, there are some similarities in that what we keep saying to CDC is we know how to handle vaccines because we already do it. There's a supply chain in place. Let us use that.
Mhm.
The second part of that is we know how to give 2 doses of the same vaccine. We already do it with several childhood immunizations. We do it with Shingrix, which is a 2-dose vaccine. So that's not hard for us. We know, what to do. And quite frankly, the nurse at the facility knows what to do too. And I'm talking long-term care. Assisted living might be a little bit different in that they don't always have a nurse per se at the facility. So they might have to contract, with the Visiting Nurse Association, or maybe Diamond will, supply some personnel to do that. We haven't quite decided, but there are definitely some options out there.
Yeah, it's always great to have options. Now, Deb, I wanted to ask if you could speak how much you could speak to this. You mentioned the planning meetings that you have here with at Diamond. What are steps is the long-term care division taking to, I guess, logistically get ready for this?
Well, there are certain agreements that have to be signed. They're called MOUs or MOAs, Memorandum of Understanding or Memorandum of Agreement.
Mm-hmm.
We are looking at contracts. Our legal department is looking at contracts. We've been talking with different departments about different capabilities. There's still a lot of unknowns, Adam. So we're just doing our very best to be as proactive as we possibly can be, in case the vaccine, we get notification like on a Friday that, hey, the vaccine is coming to you next Wednesday. It really could happen that quickly. And at that point, we would have to alert the facilities that we would then be sending to facility A, B, and C on Thursday, E, F, and G on Friday. And so they would have to then get ready for their clinic day 1. That's what it's being referred to. And that's the day that you would immunize all the residents that you have in the building on that day. Then you would set up clinic day 2. That would be in either 21 days or 28 days, because that looks like when the second dose has to be given of the vaccine. And you would make sure that everyone that got the first dose got the second dose on that day, and then any new people would start with the first dose. Then you have clinic day 3, where you would finish all those from day 2 that needs the second dose, and then any new people. So I know that might be a little hard to follow, but that's really the model that CDC wants to see in each of the facilities.
No doubt you're taking every available minute to refine and be ready when that vaccine is ready to go.
Yes. And we think that the public health departments in each state will be involved as well. So we're waiting to hear. That might be more for like the community days when, in the summertime when everyone can go to the public health departments and get their vaccine. But we're not 100% sure about that yet.
Well, either way, it's going to be a very interesting and challenging months ahead. And it seems like, Deb, you're doing your best to stay on top of it, you, your colleagues, and everybody in the organizations you're affiliated with. And we look forward to seeing how we get this vaccine to the people that need it most. Well, thanks for joining us yet again on PodcastRx, Deb. I'm sure we'll have another conversation again reasonably soon.
Thank you, Adam.
This podcast features conversations with healthcare professionals. Their statements and opinions discussed herein are for informational purposes only. This podcast should not be considered professional medical advice and should not be used as a substitute for the advice of an appropriately qualified and licensed healthcare professional. Therefore, listeners must not rely on the statements made herein.
PodcastRx is a production of Diamond Pharmacy Services, the nation's largest correctional pharmacy provider. Catch our new episodes on Apple Podcasts, SoundCloud, Stitcher, Spotify, or wherever you listen to podcasts. Please rate the show and leave us a review. And if you have a topic you'd like to hear about on the show, or you'd like to share your thoughts on an episode, you can email us at podcastrx@diamondpharmacy.com.
Music in this episode by Wolfgang Worley. Sound expressed by Getty Images. Additional music by the 126ers and Silent Partner.